You've mentioned China, and Senator Schneider, I know, is going to ask you another China question before we're done. But before we go back to him, let me ask you a healthcare related question. Amphrey Chamber represents about 12,000 small businesses around the country, and one of the great issues we hear about all the time from our members is my premiums are going up again and again and again. Let me, in the interest of time, I'll give you two questions in one, okay? One, we're now into a second decade under Obamacare that promised that it would get premiums under control. It didn't do it, and we'd love to hear the DeSantis plan to get those premiums under control. Related issue, and I know you've worked on this as governor. You signed legislation on the PBM matter into effect in Florida. Highest, fastest growing part of healthcare costs, increasing drug prices. How do we get premiums under control? How do we get drug prices under control so America's businesses can afford to provide the benefits to their employees?
Well, the pharmacy benefit manager, so we tackled this in Florida. It's kind of the middleman with these drugs, and they mark it up and they pocket a lot of money. And basically, the consumers pay the bill, and it causes their prices to be higher and higher. It's basically just an arbitrage opportunity. It's not adding value to the overall economy or even the prescription drug market. So we nuke that in Florida. We now have the transparency, and other states have done it too. I know Iowa's probably going to do it in the next legislative session. So that's important. We should definitely do that nationwide. I mean, look, part of what we're seeing with healthcare is what we're seeing everywhere in the economy. When you have inflation, all this stuff goes up. And healthcare has been going up for a long time, but you can't have inflation be what it is and expect healthcare premiums to go down. You got to get the inflation under control just to even have a chance to tackle this. What we've done in Florida is recognize that markets work when there's price signals and when consumers make choices that are efficient. For example, if you are going to go buy a car, and similar cars, one is $5,000 cheaper, same performance, you're probably going to go with the one that you can save $5,000 on. I mean, because you'll save money and do that. Well, with healthcare, if you're on Medicare, private insurance, whatever, that's a third party paying for that. So if the person down the street, if you need something to work on your knee, is charging a certain amount, person maybe 2 towns over is charging it cheaper, it doesn't really matter to you because it's going to be paid by a third party. So what we did in Florida is we created price transparency. So you can actually go up and look to see if you need a procedure, how much does it cost at these other areas. But that's not enough because the consumer has to have an incentive to want to shop around for that. So we did, through our state employee program, something called shared savings. So if you shop and use our transparency tools and you choose a procedure at a place that can do the procedure cheaper, you get reduction in your premiums. So you're making decisions that are financially smart, not just for the overall market by paying less than that, but also putting money in your pocket. So you got to connect the consumer to some of the things that are happening. Some of that is health savings plans. There's a lot of different things that you can do. The other thing I'd say is we have to make it so that private medical practice is something that's viable in this country going forward. 50 years ago, most doctors would graduate medical school, they'd go into private practice. Now a lot of them are becoming salaried employees at like massive hospital conglomerates. And that means, I think, a couple things. One, I do think it's going to be less likely to have people want to even go through medical school because I just don't think the financial payoff is as good as if you were in private sector. So some of these talented people, maybe they'll go to private equity, maybe they'll go to other things. But then the other thing is what about the doctor-patient relationship? That's been put to the back of the bus. You have big pharma, big insurance, and kind of these big hospital conglomerates, big government. It's all about moving money around to those 4 entities, and the doctor and the patient are almost an afterthought. That is not a good pathway. So I think part of it is too much government. I think it's too much regulatory burdens. We don't have the ability to make the choices that we need. And yes, we do need to do things to get at these pharmaceuticals because it's just not, it's not affordable for enough people, and you need to have that to be something that people can actually achieve.